Hinted earlier, let's talk health now. This time around in the Federal Capital Territory Administration, that's the FCTA, as the authority has now commenced the screening of 250,000 residents for the management of hypertension and diabetes in Abuja. This 7-day free screening exercise, which began on November 28th with the theme Know Your Number, Control Your Number, is part of a nationwide campaign to screen 10 million Nigerians for blood sugar and blood pressure levels. This to combat non-communicable diseases which often develop silently without symptoms and pose significant health risks. According to the mandate secretary for the FCT Health Services and Environmental Secretariat, Dr. Adedolapo Fasawe emphasized the importance of the campaign, assuring residents of the safety and efficacy of the screenings, with referrals being made to government hospitals for severe cases. She added that government hospitals, primary healthcare centers, mosques, churches, markets, garages, and parks will be included to maximize the reach and convenience. Well, she joins us now from our Abuja studio talking about the mandate secretary for the FCT Health Services and Environment Secretariat, Dr. Adedolapo Fasawe. Thank you for joining us on the program. Tell us some more about this initiative.
Good morning. The initiative is called Know Your Number, Control Your Number. What are your numbers? Your blood pressure and your blood sugar. How do we control them? By lifestyle, by diet, or by medication? This initiative is a subnational program of all commissioners of health in the 36 states plus FCT. And what we aim to do is screen Nigerians for hypertension and diabetes. Hypertension is high blood pressure, diabetes is high blood sugar or glucose. This came to be because non-communicable diseases are currently on the rise. We focused a lot on HIV, malaria, tuberculosis, and slowly hypertension and diabetes starts to creep in to our epidemiology. And we notice that the prevalence is getting higher and higher. In simple English, you see more people, otherwise healthy, dropping dead, just dropping dead. We are also seeing that younger people are developing hypertension and diabetes, particularly in the north-central parts of the country. A recent study showed that we have quite a very, very, very large number of people living with hypertension and diabetes here. It could be attributed to high salt diet or lifestyle. So we want to screen you, encourage you, if you have normal figures, to keep it normal. If you have abnormal figures, how to get it to normal. Basically, improve your quality of life. Now, we don't only screen. We offer treatments, and we offer health insurance so that your treatment, if you cannot even afford it, is guaranteed by the FCTA under the administration of Barrister Yelson Wike. Thank you.
All right, so talk to us about this campaign more. Speak to it in the sense that how is the FCTA going to ensure equitable access to these screening services, and how long is this campaign going to run? Is it until you get to the 10 million target?
Thank you. So nationwide, we aim to screen 10 million people. In Abuja, our quota is 250,000. From October 30 to November 5, we would take this campaign to people where they work. As you can see, the campaign is in the Secretariat right now, where we're taking it to the markets, to the motor parks, to churches, to mosques, because health-seeking habits is not particularly good around here. And we can attribute it to people not having time or not having knowledge, not knowing that these things should be checked regularly. So we have 200 locations in Abuja covering all the area councils. For the nearest location to you, you have to check your area council. And in even each area council, we have a screening desk. In the end, we hope to achieve even more than 250,000. The national figure is 10 million. That's why it's called Project 10 Million. At the end of 1 to 2 weeks, we hope to have screened 10 million Nigerians. And you ask me why? Why is because hypertension is also known as a silent killer. Unfortunately, at the early stages, without detection, you may not even have signs. You may not even know. From the screening we did yesterday, at least 20% of the people who had high blood pressure do not even know they have high blood pressure. That is the essence of the screening. So that in the end, you can live life, you can work, even apart from your health, the GDP and your productivity is improved for the nation.
Right, and we understand that this program, targets everyone, or you can help clarify the expected beneficiaries of this screening initiative, because you said something earlier ago when it kicked off on the 28th, that civil servants are not left out and are encouraged to maximize this opportunity. Tell us some more about how strategic this initiative is in the expectation that it will capture all those who should benefit from it.
So, hypertension and diabetes, in what we know in medicine, used to be a disease of lifestyle, old age, obesity. But right now, we're finding out that age doesn't matter. Your lifestyle is not a large predisposing factor. So we are targeting mostly adolescents and above. Anyone who is an adult, who can walk alone, go out alone, walk on the streets, is our key population.
All right, so talk to us about how this project is expected to address the general health situation in Nigeria. You mentioned earlier that it is a project that will be undertaken by health commissioners across all the 36 states. So how is this meant to address the general health concern that we have in Nigeria?
So for us, it's called health promotion. Health promotion is tagged as prevention is better than cure. We are advocating, we are teaching, we are educating and communicating with Nigerians to tell them the predisposing factors to these diseases. For example, obesity, high salt diet, sedentary lifestyle, not exercising, and unfortunately, this disease is also inheritable. If you have a family member who is suffering from hypertension or diabetes, you are most likely, with other factors, to have hypertension and diabetes. And how would this help Nigerians? When I say people are dropping dead, people are practically dropping dead. We're trying to reduce the prevalence of hypertension in Nigeria. And how do we reduce this prevalence? Early detection, treatment, and lifestyle changes. I would be happy to say and let you know that Barrister Yelsom Wike has directed that anyone who needs medication be given 1 month free, absolutely free medication. This is a form of palliative, as I would want to call it, to Nigerians, so that the money you would have used to buy medicine can be directed at other things at this current trying times for us in this country. Also, to help Nigeria understand that hypertension and diabetes is not a disease of the affluent or the poor or people who work so hard. It can come to anyone at any time. Once you are aware, once you know your numbers and you can control them, this country will be better health-wise. Our indices will become better. For example, hypertension in pregnancy is a very dangerous situation. We're trying to reduce maternal mortality in Nigeria. If we succeed in this mass campaign, obviously our health indices will improve, maternal mortality will reduce, and early death, cardiac diseases, kidney diseases, complications of diabetes, all of these things affect your outputs in life. It affects your social life, it affects your work life, and if this is controlled by government and you have access to health insurance for sustainability, obviously we would have a healthier workforce. A healthier workforce means more productivity, improves GDP, and just generally a better quality of life for Nigerians.
Right, and of course, looking at the worrying indices, and which is serving as a leverage for your program, also walk us through what is expected or what residents should expect from the FCTA beyond this screening stage.
So as I said earlier on, beyond the screening, we will be providing interventions. Interventions in the form of medication, health insurance, which gives you access to free health care. This is also an opportunity to increase uptake and enrollment in our health insurance. I'm happy to announce here also that every pregnant woman is considered vulnerable and registered for free in our FCT health insurance scheme. And what does free mean? Your antenatal care, your scans, even if you have to deliver by cesarean section, it is all free in our general hospitals and selected private facilities. It is the same system that we are transferring to these non-communicable diseases. If we find out that your poverty index is high, you cannot maintain continuous supply of medication or compliance with medication, we will register you on our health insurance scheme and you will get these drugs for free.
All right, that's a great one, and it's a vital opportunity for early detection and better management of this. So talk to us about the screening point. How many screening points will you be having till the end of this program?
So we have 200 screening points in the FCT. These screening points were determined by density of areas. AMAC, as an area council, has the largest number of wards, has the largest number of residents. So they have about almost 80 screening points. And these screening points are places where people go normally, the markets. When you get to a screening point, there's healthcare official to take your blood pressure, take your blood sugar, and enough information, education, and communication materials with a feedback and a referral system right there. We plan to put screening points in churches, in mosques, in schools, in higher institutions, in motor parks, in secretariats, in offices for a week. So that if you don't have time to show up today and you see us right there every day, you will show up. Not only that, we have community sensitizers, we have community town criers, we have mobilizers to help us attract people to the screening point. And I believe the media is a veritable advocacy tool. As I'm speaking here, I hope anyone hearing me will take advantage of this innovative, life-saving, and particularly free program of Know Your Numbers, Control Them.
And so far, since the 28th, this is expected to be the third day or thereabout. Give us, a sense of the reception.
So, it started on the 28th nationwide, but in FCT we launched yesterday. And by the end of work yesterday, we had screened over 1,000 civil servants. And out of the 1,000 civil servants, about 40%, which is a very, very high figure, had raised numbers. Out of these 40% with raised numbers, almost 70% did not know about this situation. Luckily, we have a staff clinic. You are referred straight to the staff clinic because it is difficult for you to follow up in a general hospital or a primary health care center. The staff clinic is right there in the Secretariat. And I believe this would encourage you to access medication. We are hoping that over the next couple of days, we would achieve our target of 250,000. And if there's a need, we see a present need to deploy more people to certain areas, or there's a high demand, we will continue this program. And we have a sustainability plan. In Abuja, we have almost 257 primary health care centers. And this program is a norm in our primary health care centers. We want people to start to believe in primary health care. We want people to start to walk into our health centers, get free blood pressure tests and free blood sugar tests, and have access to medication. Once we are able to complete this program, fulfill our promises, I believe it will give the residents of Abuja more trust in the health systems, and this would help us increase uptake of free health care. We want to make health care accessible, affordable, and within reach. This is why we are particularly saying, know your numbers. We have brought this to your doorsteps. Nearest motor park, nearest bus stop, nearest markets, we are there. We have over 200 screening points across the 6 area councils in the FCTA. And like I said earlier, for the next 7 days, we are hoping to meet 250,000 people. Nationwide, 10 million appears ambitious, but we will continue moving till we get something.
All right. Let us know if you also have any plan as regards, follow-up of some of these tests that have been made. I mean, beyond the referral that you mentioned, some persons may not want to even join this program because, like they say, what they do not know will not kill them. So perhaps the health practitioners on ground provide lifestyle modifications for those that possibly have, some sinister results in that sense.
I didn't get that question.
What I'm asking you is that health practitioners on ground, are they perhaps beyond the referral that is in place? Do they also give advice as to lifestyle modifications and all that? And how do you also ensure, compliance, especially for those you take to the markets, to the garages that do not want to join this program, in the sense that they may believe that what they do not know will not kill them? I hope you got that question.
Yes, now I get it. What you do not know can kill you. That is part of the message we are sending out there. Hypertension is also known as the silent killer. We have over 1,000 people out there as we speak, giving out information, educating people, communicating with them, and saying precisely what you have asked me. What you don't know can kill you. And as you have rightly said, it is not fair to tell you you have this disease when you don't know, and otherwise you are walking around healthily, yet you're dying slowly. So we follow up with medication. We follow up with knowing your numbers. Once you know your number is high, we give you medication. You see that your life has changed. You see that things are easier for you to do. You see that your physical wellness is better. I believe that you would continue to take this medication and you will continue to access it. Outside this program, it is a continuous thing. Health promotion is a way of life. Primary health care is targeted at prevention is better than cure. Prevention is early diagnosis. Prevention is knowledge about what causes these diseases. Like I said earlier, for example, if your mother is severely hypertensive, once you get to that adolescent age, you should be conscious of the need to know your numbers. At least once a year, check your blood pressure. It is not just a program that will end on the 5th of November. For us in FCTA, primary health care is a lifestyle. Health promotion is a lifestyle. After we pack up our canopies, pack up our screeners, the primary health care centers are still there to continue this program. This program we're bringing out is to help people gain the trust of the health system again. Gain the trust that in FCTA, our health system works and we deliver what we promise to deliver.
All right. And of course, this crucial intervention is also coming at a time where the health sector is in, well, to observers in dire straits, needing, an urgent state of emergency. One of the indices, the worrying indices, is, the number. We don't seem to have sufficient healthcare personnel, but now you are running this program not in the health centers, but on the streets around the FCTA. Tell us how you are working around this shortfall.
So, we will not rob Peter to pay Paul. We will not bring our health workers out from their normal duty posts because we want to check people on the streets. We have lots of volunteers. We have people we have trained to check blood pressure and check blood sugar. We have non-doctors. We have CHUs, community health workers. We have nurses. We have even trained volunteers to check blood pressure and blood sugar. The good news is that, yes, human resource and health is in dire straits in Nigeria. Yes, we have doctors living in droves every day, the Japa syndrome. What are we doing about it? We are trying to reduce the workload in the general hospitals by ensuring that the primary health care takes care of most of these ailments: malaria, diarrhea, hypertension, diabetes, can be treated at the primary health care level. Except you have complications, that is when we refer you to the general hospital. If it's a new diagnosis, you have never heard of it before, diagnosis cannot be made at one check. We are there for a week. If persistently your blood pressure is high, for 3 times of check, we send you to the nearest primary health care center where the personnel are still there. These testing centers that you see are not treatment centers. The people in the primary health care centers are waiting for referrals, and the doctors in the general hospital are prepared for this exercise. In every general hospital, 14 of our general hospitals, we have 14 here in FCTA, each one, as we speak, has a know your number, control your number room, where patients that are referred don't have to go through the bureaucracy of registering in the hospital and queuing in the hospital. They will be onboarded through our electronic medical records into the system of the PHC or the hospital nearest to you. It is a problem. Health, human resource in health is a problem. But remember, in the time of Olikoye Ransom Kuti, we were taught something called task shifting. That means you don't have to be a doctor to be able to check blood pressure. You don't have to be a doctor to be able to check blood sugar. Even at home, there are private machines, people have machines that they use at home digitally to check their blood pressure. So in terms of human resource, we are good. We are ready. And these people have been trained, they have been tried, and we have standard operating protocols on referrals based on the numbers you find for each person.
All right, this is a good initiative, and it's also a call for community participation and also, compliance. But let's talk about what other plan do you have beyond this, especially for those watching and saying that I do not have diabetes, I know my numbers. So what other plans are in place in terms of health? What other options are available to others who possibly know their numbers?
So this is an opportunity. That's a very good question, thank you. For those who know their numbers, think of how much you spend buying medication every month. It is an opportunity for you to enroll on the FCTA health insurance scheme. For a minimal amount of money, you can get free health care annually. You know your numbers, you know the medication you're on. Enroll on our health insurance scheme. If you're tagged vulnerable, that is poor and cannot afford medication, we would register you for free. We have indices and ways of confirming that you're vulnerable. And if you can pay, it is only 12,500 naira for the whole year. And I reiterate again, it is free for pregnant women that reside in FCTA. It is an opportunity to enroll on our health insurance scheme, right, and take advantage of insurance.
All right, a fine place to rest our conversation. We thank you very much, Dr. Adedolapo Fasawe, who is the Mandate Secretary for the FCTA Health Services and Environment Secretariat. Many thanks again for your time with us, and we wish you well during the course of this initiative and beyond.
Thank you. It was a pleasure being here.